Hello, good evening. My name is Dr. Chudi Ufundu of Snowspirations Global Health Solutions. Thank you and welcome. Today we're going to talk about pregnancy tests. How many pregnancy tests do we have? How do we confirm pregnancy? What are the things we look out for? How can we say for sure that a woman is clinically confirmed pregnant? Very important topic for so many reasons. So please, when you join, just for completeness, let's know your name, let's know your location, and we're going to have extensive discussion about various ways of confirming pregnancy before you can start telling other people. Very important topic for so many reasons. So please quickly settle in. As soon as we have a very good response from the people that join, I'm going to start my discussion. So today we're going to talk about the ABC of pregnancy test. Facts every woman must know. So if you're intending to become pregnant in 2023, if you've been going through a lot of pregnancy tests, are you really doing it correctly? What do you need to do differently? What should you be looking out for that will tell you for sure you're in the right direction? So if you think you might be pregnant, taking a pregnancy test as soon as the first day of your missed period, depending on the type of pregnancy tool you're using, it's very important to help you to start your care very early and to get the support you need. So very important, please, when you come in, announce your name, go to the comment section, tell us your name, tell us your location, settle in. After my presentation, you will have opportunity to ask me a lot of questions. Now, there are principally three types of pregnancy test. Three. The first one is the urine test. The second one is the blood test. And the last one is ultrasound test. Now, blood and urine tests are all checking for one thing, a particular so-called pregnancy hormone. The name of this pregnancy hormone is called beta human chorionic gonadotropin. Don't worry about the big medical jargon name. Just know anytime you're going for your pregnancy test with your urine or blood, we are checking for beta human chorionic gonadotropin with an abbreviation of HSG. That's what we're going to check. Now, you can only do your urine test at home. Your blood test must be done in the hospital, in your doctor's office. So among the three tests you can run just the urine test at home, but the blood test and the ultrasound test must be done in your doctor's office. So a home pregnancy test can tell you whether you're pregnant or not with almost 99% of accuracy. So your whole pregnancy test is simply a qualitative test. So urine test is a qualitative test. It's just going to tell you you are pregnant or you're not pregnant. Depending on the testing tool you're using, some of them will tell you to look out for a bold line or a plus sign, or some of them will give you a smiley face and congratulate you and tell you you're pregnant. So personally, if I were to check for pregnancy test using the urine, I will go for the one that will congratulate me and make some noise. It will give me a lot of good feeling. It will give me a lot of endorphins. But there are other tests that will tell you to look for double line, to look for a tick line, to look for a plus sign. So it depends on the tool you're using. If your pregnancy test is positive from the urine sample, that's not the end of the discussion. That's just the beginning of the discussion. The next step, how soon can you check for this home pregnancy test? Now, based on the newer technologies, there are some test kits you can actually check even before you miss your period. So there are some very sensitive pregnancy test tools which you can check before your missed period. So you will get more accurate results if you wait after the first day of your bleeding. No, sorry, after the first day of your missed bleeding. But there are newer test kits which can pick it up before you even miss your period. So it depends on the sensitivity of the pregnancy kit you're using. But generally, in our group, we recommend waiting for 7 days. The longer you wait, the more the probability the level of the beta HCG will come up. So you will not have a false negative test. When you have a false negative pregnancy test, it means you are pregnant, but you falsely got negative test. Of course, we don't want to give you negative vibe. Some people can also have false positive test. If there is anything I want you to have, I want you to have false negative test. I don't want you to have false positive test, because when you have false positive test, it means you are not pregnant, but the test kit told you you're pregnant. So I would rather you have a false negative test so that when you go for your blood, you will pick the real test. So you have to wait for 7 days in my group. I don't want you checking with just baseline home pregnancy test kit. The first day you miss your period, you begin to run up and down. You begin to build up a lot of anxiety. Possibility you might be pregnant, but you're checking early. So it will be harder to get a positive test if you check too early, because at that early stage, the level of beta HCG in the urine will be minimal. Now, beta HCG is actually started when the fertilized egg is implanted. So the level of your beta HCG will start going up and will be obviously noticeable in the urine by the time implantation is done. Now, implantation will be done about 10 to 14 days after fertilization. So this should usually happen about 10 days after conception. So conception is when the sperm fertilized the egg. Generally, we advise waiting for how many days? 7 days. When you check too early, you might get a false negative test. False negative test means you are pregnant, but you check too early, and the quantity of beta HCG in your urine is not enough to be detected. Now, if your pregnancy says you are pregnant with your urine, what do you do next? You book an appointment with your doctor immediately. When you book an appointment with your doctor immediately, what are we going to do in your doctor's office? Blood test. Blood test is superior to home urine test. Blood test is both a qualitative test and a quantitative test. So when you get to your doctor's office, we're going to collect a blood sample from you. When we collect a blood sample from you, what are we going to check? We are going to gradually check for the quantity of the beta HCG. Very important. Quantity. If you are pregnant, it's expected that the beta HCG will increase every 48 hours. This is why we want you to wait up to 7 days, because the further away you go, the more likely you're going to get the result you're looking for. When you go for your blood test, we are going to confirm you are pregnant. First of all, pregnancy will be positive in the blood before it goes to the urine. The urine is an ultrafiltrate of your blood. So the beta HCG will be first of all noticeable in the blood before you can notice it in the urine. So if you check your blood test without checking your urine test, possibility you're going to get positive is very high. If you are pregnant, if you are not pregnant, both of them will give you false results. So if you have access to blood test, you can actually skip the urine test. The urine test is also good because it gives you an opportunity to be in charge, to check for yourself, to feel that excitement. Unfortunately, so many women have had so many negative tests to the extent that even when they get positive tests, they are still so worried. Now, if your pregnancy test tells you you are not pregnant, could you still be pregnant? What do you think? The answer is yes. So there are some times you might make mistakes. There are some times you might be in a hurry. There are some times your kit might be expired. There are some times you will get negative whereas you're positive. So it's possible to be pregnant and get a negative test. It depends on how accurate the home pregnancy test you're using is. It depends on how you check. So each woman will ovulate at different times based on your cycle. So there is no one universal way of checking this. So the fertilized egg can also implant in the womb at different times. So sometimes some women will get false negatives because they check too early, like I explained. And false negative means you are pregnant, but the test showed you are not pregnant, and your anxiety will be all over the place. Now, the problems with getting your pregnancy in the urine is the fact that it will first of all be positive in the blood. So if a test says you are not pregnant, please take a couple of days, like 2 days afterwards, check again. By the special grace of God, you would have received your positive test. The reason is because the urine beta HCG doubles within 48 hours. So if you check in 2 days, for example, if you missed your period yesterday, be Monday, and you check by tomorrow, possibility you're going to get a positive outcome is very high compared to checking on Sunday. So take some few days, and once you get that positive test in your urine, book an appointment with your doctor immediately. Now, what if you can't tell whether you're positive or negative? There are some people that are so apprehensive, they can't even read the instructions, or for some reasons, it's just faulty. So there are some times it will be hard to tell if you're positive or not. It depends on the type of kit you're using. But here's the good news. The line may be faint, or you might worry whether you pee too much on the test strip or too little. No matter how faint the line is, or no matter how faint the plus sign is, you are most likely pregnant. So if we are telling you to look out for a plus sign and you saw it faintly, possibility you're pregnant is very high. Possibility you check too early, it's high. So the faintness of your line can mean you are early in your pregnancy. So you go and get some break and you come back in 2 days. When you check in 2 days, the full pregnancy will be manifest. So the pregnancy can have control lines. So control line means what will tell you if you got it correctly. Read the instructions. Follow it religiously. If you are pregnant, you're pregnant. Nobody can take it away from you. Now, what should you consider before buying any test kit over the counter? The cost. Generally, it's affordable. There are so many types out there. Many stores will sell it over the counter. So over the counter means you don't need prescription. Now, the cost will vary based on the brand you're using, but you need to focus on accuracy. Most of them will tell you it's going to be accurate. So some newer methods, some newer kits will actually pick pregnancy test even before you miss your period. So it depends on the type you're using, but be on the lookout for the cost. It should not be ultra expensive, and be on the lookout for accuracy. Now, what are the different types of pregnancy tests? I've already mentioned that: urine test, blood test, and ultrasound. Your urine test is a qualitative test. Your blood test is both a qualitative and a quantitative test. Your ultrasound is the clinical evidence that you're pregnant. So when you've done your urine test, you've done your blood test, the ultrasound will show us evidence of pregnancy. So what's the evidence of pregnancy we're looking for in ultrasound? Gestational sac and gestational pole. Gestational sac and gestational pole are the two evidence that will tell us, hey, this lady is pregnant and the pregnancy implanted appropriately in the womb and is developing okay, and we're very happy about that. So once you get your blood test, we're going to schedule you for pregnancy test, checking the womb, to the ultrasound, and once that is done, then we're happy. Once we are happy, you register for your ANC immediately. Very, very important. Now, no matter how tiny the amount of HSG is, when you go for your blood, possibility we're going to pick it up is very high. Now, how do you use the pregnancy test kit? The instructions are there. Pretty much there are a couple of instructions they might give you. They might tell you to hold the stick in your urine stream, or they might tell you to pee in a cup and dip the stick in it, or they might tell you to pee in a cup, then use a dropper and pull out some drops and drop in a particular paper. Follow the instructions appropriately. Don't be in a hurry. If you're in a hurry, you're going to make mistakes. So different brands will tell you to wait for a couple of times. Personally, I will tell you to wait for 10 minutes. Some people check too early. They are so worried, they are so anxious, and they quickly think they are negative when they are positive. So depending on some tests, they will tell you to check for 5 minutes. They will tell you to check for 2 minutes. Personally, I will tell you to wait for what? 10 minutes. So if they ask you to look for sign of plus, or if they ask you to look for double line or whatever it is. Personally, go for the electronic one that will tell you you're pregnant and it will sing for you. Personally, if you can step up the cost of buying your own because you've been doing the right thing and it's your time to be pregnant. So you can do that. So whichever way, whichever instructions they give you, please follow it religiously. Now, how accurate are the home pregnancy tests? Pretty much accurate. If you're pregnant, you're pregnant. But we need to look for the expiring date. We need to make sure you're using it appropriately. We need to make sure you're waiting for at least 10 minutes. Like I told you, wait for 10 minutes. Now, depending on when you use it, if you use it too early, definitely you're going to get negative results. So take some time to use it. Now, use it appropriately. Now, some women might have so many variations in their body. So two women might check their pregnancy test at the same time. One might be pregnant, the other one will not be pregnant. It doesn't mean the other one that is not pregnant cannot be pregnant. There are some factors that will predict if she's going to be pregnant or not. So take some time. If you didn't get a positive pregnancy today, check in 2 days' time. By the grace of God, you'll be pregnant then. And even when you get a pregnancy test, step up and go for your blood test. Very important. Now, what if you have irregular periods? Some women, unfortunately, have irregular periods. So when you have irregular period, it means some months your period will be 41, some months it will be 19, some months it will be 25. It's all over the place. So women that have irregular periods should also apply some tips, which I'm going to give you. So what you need to do if you have irregular period, I want you to count 36 days. Count 36 days from the start of your last period. Or you count 1 month from the last time you had sex. If you count backwards 36 days or forward 36 days from the last time you had your period, at the expiration of the 36th day, on the 37th day, that's the appropriate day to check. Or if you count 1 month from the time you had sex without protection, that's about the right time to check. This is applicable to women that have irregular cycle. If your cycle is regular, you definitely know how to do the right thing. So can anything affect the pregnancy test? Yes. There are some drugs that will give you false positive pregnancy test. So if you're on any fertility treatment and that fertility drug contains beta HCG component, it will tell you you're pregnant when you're not pregnant. Fortunately, there are no other drugs that can affect the result of your pregnancy test. But any hormone-based drugs, especially containing beta HCG component, can give you a false positive. I don't want you to have false positive. False positive, it's just very anxious test. I would rather you have a false negative. Remember what happens when you have false negative. You are pregnant, then you check too early and you got negative. But if you check later, you're going to get positive. So the test can be affected by any of these drugs, any of these medications, which contain beta HCG. And if that happens, you're going to be in trouble. Okay? Now, I've already explained how the pregnancy test works. We are checking for beta HCG in urine and blood. Very simple. If it's there, it's there. Pregnancy is all or none. There is nothing like, oh, I feel like I'm pregnant. It's either you're pregnant or you're not pregnant. So when you follow all this, by the special grace of God, once we confirm you're pregnant, then your journey to bliss, your journey to heaven on earth will begin. You register for your ANC, especially within the first 3 months. Very important. The earlier you register for your ANC, the better we can start your management carefully so that in 9 months you will have your baby. Thank you. That's my presentation. I'm going to open the clinic now to give you an opportunity. Please start asking your questions. The clinic is open. COO, thank you so much. Please feel free to ask any question you want. Immediately after this clinic, I'm going to run another clinic on Facebook. That's going to be my last clinic. Then after that, we're going to round up. Sometimes at-home pregnancy test will say positive, while lab test says negative. What happens? Because the home pregnancy test. Okay, let me read your question again, Kenneth. Sometimes at-home pregnancy test will say positive, while the lab blood test says negative. It was not done properly. That's the false positive test. That's the false positive test we don't want. Remember the difference between false negative test and false positive test. When you have false positive test, it means likely there is a contaminant. Maybe it's expired. Maybe you didn't do it appropriately. Or maybe you just didn't do it appropriately. You didn't interpret it appropriately. So you cannot be pregnant naturally and is not picked in your urine. Remember, blood will be positive first before urine will be positive. So the most reliable test is your blood. You cannot be positive in urine and you're negative in your blood. It's not possible. Your blood must be positive. Your urine might be negative, but your blood must be positive because your blood is the reference point. Your urine is the ultrafiltrate of your blood. Your urine is the waste product that happens when the blood passes through the body. So you have to get your beta HCG positive in the blood. So the blood test is more reliable to the urine test. You cannot be positive in urine and negative in blood. Now, in some situations, depending on how early you check, or depending on if you had what we call blighted ovum or missed abortion, so some women can actually be pregnant, but that pregnancy had early miscarriage. So there are some women that unfortunately they might have chromosomal abnormality. That pregnancy didn't really pan out properly, so the pregnancy is not valid. So you can actually be pregnant, but suddenly you miscarry. So the body didn't really accept that pregnancy because the body wants the best. So it can also happen in that situation. But I just want you to understand that the blood test is more superior to the urine test. So any which way, you can get negative in urine, but when you go to your blood, a couple of days, your blood must be positive. And once your blood is positive, possibility that the ultrasound is going to be positive is very high. I love that question. Very, very, very technical question. So those are the scenarios that can play out. So it's important you understand the instructions. You're not in a hurry. You're not anxious. You interpret it appropriately because once your urine is positive, you are supposed to be positive in the blood. But sometimes you might check early and your urine will be negative, but your blood must be positive. Must. You can't escape it. Now, I know some of you go to fraudulent places and they tell you, hey, you can only come to us. Please don't go anywhere. Don't go for ultrasound. It's a scam. Pregnancy obeys all or none. You are pregnant or you're not pregnant. Once you're pregnant, it must show. Now, some women might not show evidence in first trimester regarding the bump. Some women might have deep-seated pelvis. So second trimester, probably nobody will know. But once you get to third trimester, your bump must show. So you can't hide pregnancy. Pregnancy is like a fire. Once you light fire, there must be smoke. There must be flame. So there is nothing like, oh, I feel pregnant. You don't feel pregnant. You are pregnant or you're not pregnant. So avoid going to places that will not encourage you to go to the hospital. You must go for hospital. You must go for your ultrasound. If we don't see any evidence clinically that pregnancy is inside the womb, two things. You were never pregnant or you had a ectopic pregnancy. So ectopic pregnancy means instead of a pregnancy to be developing in the womb, it's developing in the tubes or elsewhere. That's a very, very deadly form of pregnancy that can kill you. You can bleed right there on the table. You can code. You can go into blue. You can die. Ectopic pregnancy is an acute emergency. We must send you to the theater. Most times, we're going to cut off that tube. If you're lucky, if it was discovered early, we can give you some drugs. So it's important you understand all this, okay? All right. Okoron Kwachi Gozie Mary Joy. If you're a medical student, if you're one of my medical students and you're in the clinic, you can indicate so I can recognize you appropriately, okay? All right. Now, another important question COO asked. Pseudocyesis. Pseudocyesis is actually the clinical medical terminology of no pregnancy or false pregnancy. So pseudo, it's false. Cyesis is the state of pregnancy. So if you have a positive cyesis test, it means you're pregnant. If you have a negative cyesis test, it means you're not pregnant. So pseudocyesis means false positive pregnancy, which you are not. So it's just like what I've been explaining. So anywhere you see pseudo, is false. Anywhere you see cyesis is referring to the process of becoming pregnant. So whatever they write in your lab report is very important. So if you're so excited and you go for blood test and you're waiting for your report, if you don't understand, you go to the nearest doctor. What we want to see is positive cyesis. We don't want to see pseudocyesis. Pseudo means pregnancy didn't happen and they gave you a false impression that pregnancy happened. I love that question, like, oh my God. All right. Thank you. This is your first time of following me. Please What can be the cause of when testing both urine and blood positive while scan says no pregnancy? You likely have what we call an embryonic pregnancy. So unfortunately, some women were pregnant, but unfortunately they had chromosomal accident. So you can be pregnant in your urine, you can be pregnant in the blood, but when we go to check for the ultrasound evidence, there is no evidence of sac. There is no heartbeat. What happened is, unfortunately, you had a miscarriage. That condition is called blighted ovum or an embryonic pregnancy. It means your pregnancy could not carry on. So the genetic material from the father and the mother didn't form properly. Somewhere along the line, you had miscarriage, very early miscarriage. Some women will not have evidence of any miscarriage, but the baby is no longer viable. That condition is called missed abortion or missed miscarriage. But when you go for your ultrasound, every pregnant woman must show evidence of gestational sac and pole. If we don't see that evidence and we check elsewhere and we rule out ectopic pregnancy, you've aborted that pregnancy. You had a blighted ovum or chemical pregnancy. Okay? How can you reach me? Follow admin, follow us to our Facebook immediately after this. Admin will give you the subscription package. If you're in Nigeria, you can subscribe and you can reach me. Only residents of Nigeria can reach me for personal consultation. If you're not resident in Nigeria, you can attend my masterclass. During the masterclass, you can have opportunity to interface with me. But before you seek one-on-one consultation, make sure you're living in Nigeria. If you're not living in Nigeria and you're planning to go to Nigeria, the moment you arrive in Nigeria, you're qualified. You have to be within the jurisdiction of Nigeria to qualify for a consultation. If you're not within the jurisdiction of Nigeria, then you have to use your gynecologist or fertility specialist in your location. I still have a few minutes, so I'm sitting back, hoping to provide you feedback. So please, if you have any questions, keep asking, okay? What can also be the cause of when pregnancy is once at 6 weeks, bleeding starts? All forms of bleeding in pregnancy are considered abnormal. Now, 6 weeks is too early for you to even know you're pregnant. Now, the implication of bleeding at 6 weeks can be a couple of things. It might be implantation bleeding. Unfortunately, it might be threatening the abortion. It might be inflammation. It might be fibroid. It might be increase in the hormonal changes in the cervix. So that's what will likely happen. But at that stage, all forms of bleeding in pregnancy are treated as threatened miscarriage, threatened abortion. You must go to the hospital immediately. There is no such thing like I'm seeing my period and I'm still pregnant. Once you are pregnant, we don't expect you to bleed at all. Any spotting, any frank bleeding, report it to your doctor. It's an abnormality. Okay? So at that stage, if it's happening and you've passed a lot of bleeding that came out in clots, unfortunately, you might have miscarried that pregnancy. And when you miscarry your pregnancy, instead of beta HCG to be going up, it will be dropping or it will just be stable. So beta HCG is one of the markers we will normally check when a woman miscarries. When you are no longer pregnant, when you have miscarriage, it's expected that your beta HCG will start dropping. When your beta HCG is not dropping or is going up, then you have retained product of conception, which is an evidence that you didn't pass out all parts of your babies from your body, and we need to schedule you for evacuation or give you some drugs. Is there a way to avoid early miscarriage? Well, majority of the miscarriages, nobody can avoid them. Nobody can prevent them. Majority of them are caused by chromosomal abnormality. So chromosomes are the basic unit that makes someone unique. So you will bring 23 from the mother, 23 from the father to make complete set of 46 chromosomes. Now, if there is any error in course of making this baby, our body doesn't want anything that is not superb. So the body will reject it. Now, there are a couple of other things we can do differently if you're a candidate that probably had previous histories of miscarriage. We're going to screen for infection. We're going to check your hormones. We're going to check for structural problems. We're going to probably check your cervix to make sure you don't have cervical incompetence. So these are the things we can do. We can give you some support. We can give you progesterone. We can place cervical sacrilege. We can treat infections. So it depends on how you present. The majority of the miscarriages, nobody can stop them. It's going to happen. It's going to happen. Okay? All right. So we have just one more question. Admin, once is 30 minutes. Give me a signal and we can transition to Facebook immediately. Currently, an ad is running on this video. It's just about 22 seconds. Once the ad is over, I'm sure it's gonna be 30th minute, then we can transition to Facebook. If you want to join me in this conversation, join me in Facebook immediately. My clinic in YouTube is every Tuesdays and every Thursdays. Sorry, Tuesdays and Saturdays. Tuesdays just about this time, 8:30 p.m. 6:30 p.m. Eastern time. Guys, forgive me, I'm getting old. 6:30 p.m. Eastern time on Tuesdays, which is 11:30 p.m. Nigerian time. Then during the weekends, 3:30 p.m. in the afternoon, which should be your 8:30 p.m. in Nigeria. So if you check me on Tuesdays and Saturdays, you will find me in YouTube. In Facebook, if you check me every day, you'll see my big head there. Okay, so admin, are we good? Thank you for coming. Please, before you leave today, make sure you set your notification in YouTube to tell you when I come live. How can you do that? Click on that subscription button. Share this video with anyone out there who will benefit from them. I appreciate you guys. It was quite a good number, a good outcome this evening. So please join me in our Facebook page, our major page, and we continue the conversation. COO, thank you so much, and I'll see you guys shortly. Bye-bye for now.